Raju sir, good morning. Can you hear me?
Very clearly hearing, madam. Good morning.
Very clear, right? Shall we start with the session?
Yeah, just 2 minutes.
Yeah.
Just 2 minutes.
Yeah.
ಮೇಲೆ Good. ಇಲ್ಲ
So shall we proceed?
Yeah, madam. Yes, we can proceed, madam.
Okay. Madam Chaitra? You are not audible, Madam Chaitra. Are you ready there? You are not audible, Madam Chaitra, not audible. Okay, speak loudly. Yeah, now you are audible, yes. Are you ready? Shall we start?
Yes.
Oh, continue.
Good morning to all. We appreciate all the participants for finding time for logging into today's webinar. I am Ms. Chaitra Nayak, Associate Professor, Tejasvini Nursing Institute. Dear delegates, dear delegates, holistic nursing practice has emerged as prevalent concept in the provision of quality of nursing care, calling nurses to focus on whole person. Holistic care is a comprehensive model of caring, which is believed to be the heart of the science of nursing. In holistic nursing care, all aspects of patient care included and it effect on treatment process.
Charge కింద
It
ಹೋಗ್ತದಲ್ವಾ
considered patient's
ಚಾರ್ಜ್
thoughts, emotions, cultures, opinions, and attitudes. And these factors are contributing to the recovery, happiness, and satisfaction. Before we begin, participant kindly note the following instructions. Kindly mute your audio during the session. Queries to be posted in the chat box. Feedback link will be provided in the chat box at the end of the webinar. Now, without further ado, we will come to our speaker of the day, Dr. Professor Raja Anthony. Dr. Professor Raja Anthony, Principal cum Professor, Unity Academy of Education, Bangalore. Dr. Professor Raja Anthony is an able administrator, researcher, UG, PG, PhD guide, and an efficient teacher. He has completed his PhD from National Consortium by INCORPOREAL in collaboration with the Rajiv Gandhi University of Health Sciences and World Health Organization. Dr. Raja has published research articles in national and international journals. He also presented many papers and posters and served as also a resource person in various national and international conferences. Dr. Raja has received many awards, which is untold, in that Florence Nightingale Excellence National Award in 2017 from International Institute of Social and Economic Reforms, Bangalore, for excellence contribution to nursing education and research. It is our privilege to have served amongst us. We would love to hear from you, sir. Over to you, sir. Over to you, sir.
Sir, are you there on the line? Raju sir? Raju sir, are you there on the line?
only thing I couldn't hear the voice of Chaitanya. Now I am hearing your
Okay.
voice.
Right. Okay, sir. Ashwin sir, stop sharing.
Yes, madam.
You stop sharing. I will share the PPT of sirs.
Okay.
Is PPT visible?
Yes, ma'am.
Yes. Okay. Sir, over to you.
Yeah, it's visible. It's visible.
Yeah, over to you, sir. You can proceed.
Okay. Good morning, incorporeal. Good morning to one and all. First and foremost, I would like to thank the management of Tejasvini Nursing Institute and the principal for giving me this wonderful opportunity to talk in a webinar on the topic of a very novelty, a very needed to our nursing profession. That's incorporeal nursing education and incorporeal nursing education and practice, a kick to holistic care. Next slide. By hearing this topic, I hope so you all a bit confusion and bit worried, but thinking about what it could be in corporeal nursing education and practice, a kick to holistic nursing care. I could read your mind voice. So let me start the webinar with a small story. Once earlier, a king, he was so spiritual, kind, love and affection, and compassionate with his all people. So the also very noble, have extended love and affection with the king. So his whomever person or whichever person visits the palace, he used to extend his excellent hospitality by providing wonderful food, dresses, and gift. Similarly, one day, a monk from a very long distance visited the palace of a king. So, similar like others, the king, very happy, he invited the monk and extended his excellent hospitality, food, gift, and dresses, everything he offered. So, a couple of days, the monk was staying in the palace. At the time, he was interacted with the king, and he was giving a lot of suggestion, advice for the ruling the kingdom or ruling the country, how to take care of the people, everything. On the day when he was leaving the palace, he gave a parchment to a king. So parchment means, in the olden days, not like papers. Now we are all the documents and important information. We used to write and keep it in papers or else electronic gadgets. In olden days, it was not like that. The parchment either may be a skin or it may be a leaf. They used to write and keep the information. Similarly, on the day when he was leaving the palace, the monk gave a parchment to the king, and he gave, in addition with that, one important information also and rules also. You should never open and read the parchment unless otherwise, if whenever you feel extreme a positive emotion or negative emotion, which means when you be in extreme happy, you have to open and read the parchment, or else when you are in utmost depression, try to end your life, you have to read the parchment. The king also agreed for the same. The thesis was going on. One day what happened, the neighboring ruler declared a war on his and defeated the king. The king lost his kingdom, wealth, all the family members. To a secret pathway, he escaped from the palace, and he was staying in a cave of the nearby forest. He struggled to continue his life. He kept the parchment with him wherever he went. So he was struggling so much to overcome the fear of the wild animals and getting the food and all the basic amenities to his life. So he decided to terminate his life. The moment he decided to end his life, he remembered the parchment which was given by a monk. So immediately he opened and had taken a parchment. He was started reading. What it was written in the parchment was, "This too will pass away." Listen, student, this is the very key moral, a key point. This too will pass away, which means this moment also will pass away. Nothing is permanent, nothing is static. Everything is dynamic, everything will change one day. So that's what this too will pass away. After reading this parchment, the king got an excellent spiritual inner feeling. He got hope, meaning, and purpose of his life. What happened? He changed his mind to give up his life, With a confidence, he gathered all his people who was living nearby villages. He formed an army and he gave training to the people. And finally, he attacked the neighboring his old kingdom against the king, and he defeated the king. He got back all his wealth, the kingdom, the palace, all his kith and kin and relatives, whatever he lost. The moral of the story, never lose hope. So that's the ultimate moral of the story, because the hope, meaning, and purpose of the life is very basic component of the spirituality. That is ultimately the spirituality feeling. So, with this story, with this moral of the story, I would like to enter into the topic. So, the incorporeal mean not having a physical body. It's not the physical component, consideration of not the physical component. It considering the spiritual form. Am I audible? Am I audible?
Yes, sir.
Thank you so much. Now, this is a question. Our is only. So now the attitude, which is the base in the tutorial form, or the spirituality of the nursing education and practice been completely missed. We are missing a lot. Next slide. Object. The spirituality is distinction between the dimension into practice. Spirituality into education and practice. Reflection on factors that might enable and integration of spirituality everyday nursing education. When we use the word spirituality, the moment you utter this, everyone has their own misconception of what it would be. The moment we refer to someone, the word seeker also goes spiritual. There is a lot of difference between spiritual seeker and spiritual believer. We might have heard the word spiritual believer. Spiritual believer belongs to certain religion, but seeker, the moment we say I'm spiritual, seeker also. A student is a spiritual seeker professionally. A scientist is a seeker, a teacher is a seeker. The student needs to be an active seeker, whether it may be any subject that are seeking for the truth. Next slide. See, truth may not be ultimate truth, but the absolute truth of the particular subject. A student is not a believer, especially a science-based, a medical-based, a health science-based student is not. Whatever information we learn is taught by a teacher. We are finding that what is, whether it's testable, whether it's truths. The should bring a discipline in the profession. A discipline is a basic quality required for a student. For example, what do you mean by a disciplined culture, a disciplined climate? In a is boring. disturbing others just to listen what a teacher says. It's a disciplined culture that every student must learn. Spiritual process is must for any genuine disciplined climate is the in the classroom is an art on teacher. That's like they will get restricted. So classroom. Next. Spiritual way of finding hope, meaning, and purpose in this frenetic usage.
Sir, your voice is not able to hear, sir. Sir, not able to hear.
Raju sir, hello. Hello. Sir, are you there? Sir, you are not audible. Yeah, I think you are disconnected there. I think you check your connection, sir. Yeah, yeah. Hello. Sir, you log in once again. Yeah, yeah. Am I audible?
Ma'am.
Am I audible?
Yes, ma'am.
Yeah, all of you kindly hold on. There is some kind of technical delay. All the delegates and the students.
Is it audible? Is it audible?
Yes, sir, I said. Yes, yes, yes.
Yes,
Sir, you
sir.
can continue. Now you're audible.
Yes, sir.
Yes, yes, sir, you're audible now. Yes. You can continue.
Distinct I will. Once again, deeply interested. The difference between religious and spiritual. Am I audible? Hello?
Yes,
Yes,
sir.
Am
sir.
I audible?
Yes, sir. Yes, sir. You're audible, sir.
Hello? Fine, fine.
Yes,
Thank
sir.
you.
You're audible,
Thank you.
sir.
Thank you. Yes, thank you. So, briefly, I will recap the difference between religious and spiritual. Religion is a specific set of organized belief and practices usually shared by a community, whereas spirituality is more of an individual practice and has to do with having a sense of the religious is by prayers and meditation, whereas the spiritual is being practiced by values and realization. They introspect the meaning of life. The beliefs and rituals found in many faiths, whereas the spiritual is connected with truth. More spiritual, the soul is a form of spirituality and religious. Anyway, all spiritual may not be religious at the same time. All the religious, and beliefs are ultimately considered incorporeal power, a moral way of living, the morality of life. Hence, all religious may be spiritual, all the spiritual may not be religious. To a holistic nursing care, a holistic care. Let me just discuss, think about what you mean by holistic nursing care. Holistic nursing care involves healing the mind, body, and soul of our patients, which involves try to heal or provide comfort or care, assist the patient suffering in the body, mind, emotions, spirituality, religion, and personal relationship. These are the some of the components of the spiritual and holistic nursing care. Ultimately, the seminar is arranged. The spirituality is a core component in holistic nursing care, which is the ultimate core of our profession. Next slide, please. What are the 5 areas of holistic health care? You all know the physical, social, spiritual, intellectual. In order to be considered well, it is imperative for none of these areas to be neglected. Dear student, at this current scenario, at this current physically a component where at times as the component still an focused aspect. Next slide, please. How holistic care acknowledge the whole patient, interact with all and colleagues mindfully and respectfully. So it's very important. Holistic concept, not only providing care in the 5 dimensions, at the same time, interact with all patients mindfully. Patients fully their share. How to do provide holistic care slide, please? How do we provide holistic care slide, please? Thank you. Interact with all patients and colleagues mindfully and respectfully. Dear students, many times how do we communicate? How do we respect the patients or patients? Only requirement. So I have come to meet you. Today is my practical exam. I have come to provide only for of hours because my teachers accompanying me. I have a requirement. I have to demonstrate. I have to fulfill my requirement. I have to fulfill my commitment. So we are off-minded. So with off mind, we are engaged in our patient care. So it's not a holistic care, dear students. Next, assess patients holistically through open communications. Many times now the communicate with the patient is seldom performed. We are going and accompanying near to the patients, but not even single word. Many times we have completed our care and procedures without asking the name of the patient or the problem of the patients. Dear student, the holistic care, if you want to provide a holistic care, assess patient holistically through open communication. Pinpoint the potential contributing stress factors that impact a patient's health. Next slide, please. What is education? So the next core, incorporeal nursing education. Before that, let us reflect ourselves. What is education? The modification of behavior is called education. After a bachelorate degree or master degree or higher and higher degree, there is no modification of behavior. There is no meaning for such education. There is no meaning for obtaining such certificates. The modification of behavior is called education. Education is an information for the transformation. A diploma level, if you acquire the bachelorate, we must transfer our knowledge, skill, and attitude should transfer from a diploma level to degree level. If you aspire, if you completed a master degree, you should transfer to that particular level. That's what education is, an information for transformation. There are two kind of education. One is a material education, another one is a spiritual education. Majority in this current juncture, in this current world, majority of the schools and colleges offer only a material education. That is otherwise called mark-based education, certificate-based education. Whereas spiritual education, very few institutions offer a spiritual education, which is otherwise known as value-based education. Next slide. All the schools and colleges teach how to get a degree, how to fetch a job, how to make a lot of money, but no colleges teach how to live. That's why a frustration, immoral way of learning, immoral way of teaching, everything. But spiritual education teaches the moral way of living. Nowadays, education has become a commercial one, business minded, rather service. The immoral way of mere material education may not modify the behavior, which leads to transformation among students, but spiritual education does it. Next slide. Let us discuss why spirituality, why incorporeal form of care is so important. The spiritual people flourish. Spiritual people have positive relationship, high self-esteem, have an optimistic view and hope, and have a meaning and purpose in life. Dear students, listen carefully. Why the main objective aim of this webinar is also why it's so important. It's so important because spiritual people have positive relationship, high self-esteem, optimistic view, hope, have a meaning and purpose in life, regardless of way it's defined or we conceptualized. Spirituality is reported to contribute to the health and well-being of individual because health is a physical, mental, social, spiritual well-being. Spirituality heals the body, cures the disease because there is no good healer than our mind. All the healing medicines are within us. Next slide. Next slide, please. Spiritual well-being is associated with a number of positive outcomes, including a greater tolerance of the emotional and physical demands of a people, of patients. Especially, we have to help the client to enhance a greater tolerance in order to decrease the pain, stress, and negative emotions, lower the risk of both depression and suicide. Patients who have received adequate spiritual or incorporeal nursing care also reported more satisfied with their hospital care and treatment. Here, satisfaction is a key component. We might have seen plenty of people in our life. There are two kind of people. One is highly satisfied, another one is not at all satisfied. We might have come across many people in our day-to-day life and our personal life, our kith and kin, relatives, family members. You might have seen some people, though you are doing a small help, they are highly satisfied. At the same time, there are some people, whatever you do, whatever you give, whatever you help, the ultimate word, they seek a fault in the particular action. They find fault in our particular help. They find fault in our the particular material, whatever we offered. We might have come across such a people spiritually not sound. A spiritually incorporeal form of incorporeal people will have high satisfaction, a more satisfaction in their life rather anything. Next slide. Next, let us discuss what are the qualities of a spiritual person. Spiritual life is like a bed of roses. The 12 essential qualities of a spiritual person are ultimately, I do feel at the end of this webinar, at least a few components we have to improve. We have to try to develop. The 12 components or the qualities of the spiritual persons are positive thinking, inner peace, egoless, unconditioned life. The current scenario, even if you extend the love, the others as a reciprocity, they are not extending. So that's what that Spirituality is unconditioned love, whether others doing or not, others helping or not. We have to help them. We have to extend our love towards others. It's called unconditional love. Then optimism, so positive thinking, and harmony. Harmony means unity, united, and humility, humbleness, responsibility, compassion. The compassion is nothing as a concern for sufferings. It is one of the basic quality required for a nurse, compassion. And the 10th quality is justice, truth, and the next qualities are simplicity and reciprocity. The reciprocity means mutual exchange, which means helping each other. Dear students, these are the key component of the spiritual care or someone to be called as a spiritual. So, dear students, please take effort, introspect yourself, gain hope and compassion to develop these qualities. Next slide. Way to motivate spirituality in education. How we can motivate our student to be spiritual. Provide a period for discussing moral values. Nowadays, every teacher spend a time for theory hour, spend time for practice. A curriculum also much emphasized on theory and practice, but there is very less emphasis is being given to the attitude aspect, the spirituality aspect, the emotional aspect of care. Provide a period for discussing moral values. Explain the outcomes of good deed. Awards for good manners. Award for the best behavior student on the occasion of annual days and graduation. We all know every annual day, every college day, every graduation program, a college, the management offers best academic award, best sportsperson award, best cultural award, best all-rounder award. But what about best behaved award? Some student may not be very intelligent, may not be very skillful, but the spiritually the person, some students may be very strong, very perfect. In the behavior, they are very, very good. But the our current curriculum is not giving more focus for such a student, not giving much focus for such a educational component. Including spirituality in nursing curriculum ensures nurses have the opportunity to explore what it is and how to address it in practice. Next slide. The next aspect is develop the spiritual health among students. What do you mean by spiritual health? Each and every teacher, the college, the curriculum, much emphasis on spiritual health. The spiritual health is about finding a purpose, meaning in our life, and how this purpose affects each and every individual and the others around us, others you around you. So that's what spiritual health is. How this purpose affects individual as well as the people surround us. The spiritual health is about self-discovery and finding out who we truly are and understanding what we the person we want to be. Next slide. Strategy for addressing spirituality involved in using particular context. Dear students, we may be thinking, we may be wonder how we can incorporate the incorporeal form of nursing care, the incorporeal form of nursing education, because current of theoretical component, completion of syllabus, completing the portions, and completing the practice component is really a great task. We feel difficult, but at the same time, we wonder, we feel how I can park the incorporeal form of nursing education. So, these students, I give some of the tips. Some of the area of nursing expects a more discussion, more dealings on the incorporeal form, the spiritual form of nursing care. The area like such as palliative care. When the teacher discussing the care of terminally ill patient, a care of dying patient, the patient who is end of life, it's a right opportunity we can deal with this and spirituality, incorporeal form of nursing education. Especially while we teach about the ethical issues, the ethical issues, the ethical issues in healthcare. So we can excellently explain our view. We can opportunity to a student to reflect, to feel, to share their emotion and feeling on this particular aspect, especially the spirituality. Not only the context, the particular content, the method of teaching, some of the method of teaching like narratives, discussion and poetry, self-awareness, reflective learning, sharing, modeling, and an emphasis on empathy and compassion. Dear teachers, while hereafter while handling nursing subjects, find a place to park the spiritual concept, the incorporeal form of nursing education. And we have to modify our method of teaching like a narratives. While we discuss, while we narrate, it reflect, it creates a empathetic feedback. Next slide, please. At the same time, as educator, we have to be very caution in certain aspect. The personal values of teachers should not be correspond. We have to various comments and situations. It should not inculcate her personal belief, her personal hope and religion on the students. It's a very sensitive area, dear teachers. Similarly, the student should be taught about the one's personal values and belief should not be imposed on patients. How I say that very not to impart the personal value to the student. Similarly, each and every nurse educator teach our students should we have to identify the spiritual compilation for care. We have to of life. The student should provide a care. Next slide. Nursing practice. For a nurse, it's also of providing meaningful and purpose to individual. Patients or patients. I said the specialty is finding a hope, meaning, purpose in life. Similarly, as a nursing practice, is providing hope, meaning, purpose for patients. I wonder why is spirituality so important in nursing practice? Based on reflection, I would like to we are more spiritual when we are pious. When are we most helpful? When are we most generous? When are we clean? Can you answer? We are can I get answer from any of the students? It's for your reflection. When we are more spiritual, religious,
Sir, there is a phrase in Kannada, Sankata Bandaga Venkatramana. So when there is some problems,
okay.
so then always they remember a spiritual.
Yeah. Yes, exactly. It's a crisis. That's what a great philosopher saying. in our life. We must not ascertain others, otherwise we will not be mature. We will not be helpful spiritual. Yes, the physical and financial and situation crisis make each and every individual to seek more spiritual, seek more religious. Patient individuals face vulnerable, for example, patients facing illness and cry whether
Sir, not audible, sir.
to develop the interpersonal connection with the patient at the same time. So, dear student, please, 1 minute. Hello, just a minute.
Yes, sir.
Is it audible? Am I audible? Thank
Sir,
you.
you're audible, sir.
Thank you. Faith of spiritualities, they also fail to develop the deep interpersonal compassionate connection with the patient. These young birds, a future nursing carefully. Ultimately, attitude is the base for practice. Unless otherwise, the nurse realize, must believe in such a form, care to the patient or kidney. Next slide, please. Ritual and the patient the spiritual needs of the patient. That's why it's more all our professional or councils. UK is actually integrated as that nurses offer holistic approach as the fundamentals of spirituality. Students very carefully. Why? I think the meaning for theme is who care in the fundamentals of incorporated application by establishing a spirituality in nursing care may harm. I think the importance of incorporeal form engaging with the spirituality nursing care is important. Spirituality help the patients illness help to find meaning and find the meaning and in personal life. It is fundamental for patients in helping them regain hope, meaning, purpose in the midst of good evidence that addressing spirituality improves a patient's comfort and illness and treatment. That's what I said. The healing nature is within us. As we provide care, that is a spiritual drug, but nature, all the healing for us. The healing nature is a form of spirituality. Hope in your life, you trust, but many times must be thing unless otherwise you believe think positive things you could. The belief is the hope. If you're going in the meter from get care by a therapist, the doctor prescribed medication must believe definitely the earlier is the ultimate of life, which gives ultimate connecting to deal with spiritual issues is carefully. If the nurse or the health professional neglect the incorporeal form, physical or emotional illness, not only a patient will not get rid of the illness, exposed to so spiritual component, the essential. What are the barriers in practice? Nurses struggle to concept quality even being important to a patient because the word spirituality no two individual come to a similar perception what it means for spirituality. They themselves struggle even though recognize it as important to their patients. A survey says that of the nurses believe that it is very essential, but only 5% of could able to meet in the 90% of the responses strongly spiritual values are very essential. Half of them integrated in training. That's what is the physical component of care. Care. What about the spiritual patient is not much given in our curriculum. Daily little time for which another barrier we know because high turnover in every hospital. nurses are having a so they try to fulfill the physical component of care, or if so what they are getting lack in time in another reduced number each and every thing a very little time complete the records to so this next one. This care is frequently provided by assistant in many areas. So the other part golden scenario, the basic care is fulfilled by the nurses. Why I am emphasize that the healthcare assistant involved in studies, involved in nursing, because the basic care opportunity interaction. So that interaction, for example, a nurse checking, providing a bed bath, the nurse is providing bed making or attending the basic care. Provides time the nurses will interact the patient. The nurses can identify, the nurses could identify the spiritual problem of the patient, spiritual how the kind lack in hope or meaning in his life. So now majority of the hospital, the basic care is frequently provided by the healthcare assistants, nursing assistant. That's what the nurses may not get a time, may not get an opportunity to realize, to assess, identify the spiritual component, the spiritual need of the patients. At the same time, dominant political, economic, and organizational cultures also not allowing incorporeal form of nursing care because a political organizational vision, mission, and economic care is for your reflection. Are you providing nurses a similar care to the patient who is in this ward or in common ward? It's for your reflection. The nurse calling out a single phone call is immediately the nurse, the ran to problems. So economic claim as incorporeal form of care. Care differs between types of wards. Organizational culture. Get quickly. A similar way that on the contract basis, sorry, they have minimum training with minimum training. Qualified are providing care. Unqualified, the person who completed SSLC or PU, what they know about spiritual aspect. So, dear students, these are the some of the barriers which assessing the spiritual needs in nursing practice. The role of the nurse is assessment because assessment is the base for strength a holistic care when the patient experience trying to cope with stress, vulnerability, and death. So, dear students, so we have to find out the where or we must try to assess the care or the meaning in their life. And admission to hospital often lead to patient to consider the meaning and purpose of their own life, because is the first step for action. Unless otherwise we assess the need of the patient, we cannot provide. Next slide. How can a nurse identify spiritual need? Question many times, sir. You said we can train. Students are trained emotional. Student provided plenty of opportunity to introspect. The excellent teaching to give emphasis to the spiritual component. The big question is $100 question is how can a nurse, a nursing student, identify the spiritual need of the patient? The patient is in great suffering. Definitely, the patient, the inner expectation. Patients often ask deeply questions and invite nurses into their questioning. Why? Depressing sister, only I'm suffering. Whomever is having a bad habit, whomever is living an immoral life, they are very happy. They are not at all suffering. I'm so punctual, I'm so spiritual, I'm so God fearing, having much faith on religious, but why for me? What does this mean? Why I'm suffering? How can I deal with it? These are the some of the clue words that nurses can excellently provide spiritual care. These questions provide an opening to explore spiritual needs. Our responses can help patients find a sense of meaning and purpose during their illness. When people are unwell, they may signal their desire to discuss spiritual issues. So whenever the patient expresses why it's for me, what is the reason? So definitely, especially when they are suffering much, it's a right opportunity. Patients are giving a clue to nurses, healthcare provider. Yes, I'm ready to discuss about the spiritual, the incorporeal form of care. When we are full, we seek more religious and spirituality. I'll discuss. I have seen plenty and plenty of students time of university examination. Everyday life they used to one time or two time they will prayer, but at the university exam time, study holidays, I used to go to hostel and see how the students are studying. Always prayer, 1 hour, other room per day, 4 times, 5 times. I have seen plenty and plenty of students holding a rosary in their hands and writing the examination. Dear students, spiritual is ultimately emphasizing, religion is also ultimately emphasizing spiritual component. Next slide. A formal questionnaire is not necessary, but questions may be useful to invite the discussion. How has this illness affected you? This is the right form the nurses can ask question. How has this illness affected you? Your relationship with your actor, has your raised any special concerns for you? Has it affected your family? How has it affected your work? So, dear teachers, it is better to avoid questioning beginning with why. Sometimes the student feel discomfort while we use the word why. Let me give a small example in our day-to-day life. For example, a good student, average student, who got a less mark or got fail mark, a single digit in a test, a teacher is calling. Just imagine, it's for your reflection. When the student will be more comfort. If a teacher asks, why you got less mark? Why do you got less mark? Or how do you got less mark? The moment the teacher asks the student, why do you got less mark? The student start reason. She want to shift her reason a acceptable way. Imagine about at the same time if a teacher asks, how do you got less mark? The word itself opportunity to the student to express in an open way to start an open communication. Teacher, I have actually prepared, whether it's because of the time or because of slow writing or because of the less effort or because of the poor remembrance. The student will express his problem in a comfortable way. So the nurse, each and every nurse, try to avoid questioning the patient why. Rather, better to use the word how. Next slide. Practice. Development education, system, and these are the three basic resources. What do you mean personal attributes? The personal characteristics of a nurses. Individual care, not those personal qualities of care, instilled in nurses during the training. So individual, already I believe individual form of care, an incorporeal form of care, definitely the nurse will instill while she's providing care to the patients. So the education is very essential. It should be instilled in the training. The second include offering care, being kind and compassionate, listening and cheerful. Some of the qualities of the nurses is a resource to incorporate the spiritual form of care. What do we learn as a child is practiced as an adult. What do we learn as a child is practiced as an adult. The training period, during the 3 years or 4 years training period, what you learn practice when you become a practice nurse, a staff nurse. Next slide. In addition with the personal quality of the nurse, their development and education in spiritual competency is more important. The educational need for training. Dear student, first question in your interview, while going for interview in hospital, where did you get trained? Where did you train? Study first question. So that systems of care encourage holistic aspect and which allow nurses to provide time to develop rapport with the patient are also essential. So ultimately, the develop a student in a spiritual way, in an incorporeal way, is on the hands of the teacher. I would like to just quote Sanskrit para Sakshat Param Brahma Svaide Guruve Namaha. So it is a Sanskrit slogan to the what it means. The slogan is the teacher is a creator. A good student. It is the teacher or the trainer. Next slide. Is it all?
Sir. Yes, sir, you're audible, sir.
Oh, sorry. Thank you. So next for increasing spiritual
Yes, sir, you're
competency, you can
audible, sir.
conclude. Thank you. What are the suggestions for increasing spiritual competence? Sir, I interested to provide spiritual care. How I can improve my spiritual competency? There are some suggestions. First one is be aware of your own spiritual or come and what is their illness mean for. Be full practical applications. So they understand as value fellow human being. So then patients. ourselves, what study, introspection. Next slide. To worry. Promote personal so don't let how compassionate and mindful you have been in dealing. Finish your duty after patient. Respectful with a small carry-home message, a simple message for all nursing students to incorporate into their everyday work for incorporeal quality care. That the Taraga mantra is I care too. The mantra is I care too. What do you mean by I do? The I denotes introduce yourself. The C stands for care, would want to be cared for. A stands for ask. What else can I do for you to your patient? The R stands for respect, dignity of E for empathize. Empathize when things and you will reply. Stands for inside it. So I to follow as a conclusion. WHO defines health is a mental and social well, not merely an absence of disease or infirmity. To modify the definition of health, a group of executives to the WHO at the 100 they recorded like health is a dynamic. The one is health, a dynamic state of complete physical, mental, spiritual, and social being. Yes, they want to. The spiritual, that was defined by the officials. The officials declared that the concept of belongs to the domain of natural science and should be kept apart from the domain of culture. Fraternity, the medical who coined the definition of health. They argue that religion is a culture, but we define health is a domain of natural science. So in this declined, they have just students. These are not for to add the spirituality in the definition of health by WHO. If not, is included in World Health Organization definition of health. Spirituality is a component of holistic nursing care. Anyone who stops, next slide. Anyone who stops learning is old, whether 80 is young. To teach is to learn wise. Dear teachers,
Thank you, sir. Shall we move to question answer session? Shall we move to question answer session?
Madam Chaitra, sir is able to hear you.
Yes, sir. Question answer session will be held by Miss Ashita Sonyani. Over to you, Ashita.
Thank you, Chaitra ma'am. Participants, kindly note, we are going to begin with the question answer session. If you have any queries, you can put up in the chat box. Sir, for your convenience, we have forwarded you the questions. We would love to hear from you, sir. Over to you, sir.
Yeah. Yes, yes, I have received.
Thank you,
Yeah.
sir.
So the participants. Why should student nurse maintain sanctity of learning? So which means why? The ultimate aim of the nurse is to be the sanctity means a spiritual form or is a incorporeal holistic way. So dear students, today's bricks are tomorrow's building. Today's buds are tomorrow's beautiful flowers. A brick is not good. How could you construct a good building? If today bud is not very healthy, tender, how could you expect a beautiful flower? Similar way, so nursing, in nursing context, you are not called nursing student, you are called student nurses. You are a nurse, but in the student form. So if you begin your career, you are beginning your career at the time of training. If you begin your career with the holistic care, not only physical, mental, and social component, in addition with that, the sanctity way, in the incorporeal form, a spiritual form, you inculcated, you first gain hope in your profession, in your personal life. Ultimately, you will provide a holistic care to the patient. I hope I have answered you. The second question, as a student nurse, how he or she can inculcate incorporeal education in terms of learning. So in the learning component, it's a really a challenging one. So that's what I said. Some of you methods, if you want to learn the spiritual form, a sanctity form of learning, the first thing is reflection, introspection, empathetic. Only these three words. First is empathetic. You are seeing a patient who is suffering. The moment you look at the patient who is suffering by pain, immediately you should feel empathetically, try to practice. Okay, so this patient so much suffering. Unless otherwise you realize the suffering of the patient, you may not provide care to the patient. So that's what I said. The realization is the first step to provide care. If you want to become a good spiritual nurse trainer, nursing student, every day you have to practice the empathetic feeling. In everyday day to life, I said, the 12 qualities of the spiritual person. You try to reflect yourself, introspect yourself. Am I mindful? Am I open minded? Am I in unconditioned love I'm extending? Whether I'm helpful? Whether I'm optimistic? So these are the qualities in your day-to-day life. You introspect, if you develop, ultimately you definitely will incorporate your spiritual care while you're providing care to the patients. The third question is sanctity and drive to learning is separated due to mind of service and professionalism? Once separated due to mind of service and professionalism. Definitely. I said, we all know The third question students asked, if sagacity and a drive to learning is separated due to mind of service and professionalism. Yes, definitely. It is the part of your service, it's part of your professionalism. So what happened due to the, already I explained it, due to the commercialization, business nature of the institution, or sometime our curriculum is not undercover the particular area. So that's what definitely uh, the current scenario not giving more emphasis or leaders or take a drive to the holistic nursing care. Why do you feel nursing education is important? I think they have wrongly typed. Why do you feel nursing education is important in nursing education? No, no, it may be nursing practice. Yes, because a correlation of theory and practice. Someone asked, why do you feel nursing education is important for nursing practice? Yes, if you are what you learn, you will practice. If you learn the right thing, you will practice in the right thing. While you are learning, while you are getting training, the proper components of holistic care, the quality nursing care, if you do not learn, you may not execute in your life. The training, the learning, the education is the first step. What you will learn, you try to practice, you put it in your action. That's the training is a major component. The education is the basic component which influence the practice. Next question. Why is incorporeal nursing education important in nursing practice and education? Uh, I hope I have, in my slide, I have already discussed why nursing incorporeal education is important to the nursing practice. The same question. Nurses face many challenges in today's complex healthcare environment. Here are 6 big issues facing nurses. Yes, staffing, long working hours, workplace hazards, workplace violence, bullying, harassment, salary. I do agree. So that's what in my presentation, the resources I have mentioned 3 points. One is the personal attributes, another one is system and organizational resources. I have mentioned in the resources, personal attributes, it's purely on nurse within us, within our educators. The second and the development and the education, the training. The third resource is system and organizational resource. Yes. Unless otherwise, we the nurses or we make our management to realize, introspect the importance of the spiritual component, it's very difficult because it's not on our control. Unless otherwise, nurses are running an institution, nurses owning a hospital, or the healthcare providers, or the spiritual personalities running the institution, running a hospital, definitely this could be possible. Otherwise, really, this is the very ethical dilemma whether whether nurses having a role in staffing, long working hours, workplace violence, salary. Yes, the third resource, system and organizational resource, definitely is not on the hands of nurse. I am ready to provide spiritual care, but if the nurse is not getting an opportunity due to the poor treating, the ill treatment, less salary, or less staffing, more workload. So absolutely, it's a challenging component. But what happened? What I'm expecting each and every young nurses, whenever you get opportunity, whenever you get even a few minutes, you get the opportunity to spend time with the patient, you try to incorporate the incorporeal form of nursing practice. That is the thing I can say. Okay, so I hope by this I have concluded my session. Okay. Thank you, one and all.
Thank you, sir. Thank you so much. I think we have addressed all the questions. Over to you, Chaitra ma'am.
Thank you, Ms. Ashita. I think we have discussed all the questions, sir. Thank you so much. Now we come to end of this event. So on behalf of Tejasvini Nursing Institute.
Madam Chaitra, you are not heard. Would you keep your speaker closer to your mouth? Yeah, right.
Okay, ma'am. Okay, ma'am. So we have come to an end of this event. On behalf of Tejasvini Nursing Institute, it is my privilege to thank our distinguished resource person, Dr. Professor Raja Anthony, for not only sparing his valuable time, but also readily accepting our invitation to be the speaker of this webinar. Thank you so much, sir, for enlightening us with your analytical, thought-provoking process and for enduring critical thinking in nursing practice. It was indeed a great deliberation. Thank you so much, sir.